Ending NARD strike issues at stake is the focus of the conversation we're going to be having right now. And you agree with me that there have been issues concerning the strike action declared by NARD, which kick-started August 2nd, and this happens to be the third week. And yesterday, there was a court case, though adjourned in the industrial court till September 15, where the federal government dragged NARD to the industrial court. And resolving these issues, I have on the ground with me the ARD, Association for Resident Doctors, President, UBTH, and he is Dr. Ofwani Ifeanyi at my extreme left. Thanks for joining me, Ifeanyi.
Thank you, sir. Happy to be here.
And next to him, we have the Secretary of the Association of Resident Doctors, UBTH, Dr. Elama Ikpemi-Norena. Thanks for coming.
Thank you.
Well, we've been having this whole issues, and Ifeanyi, there has been this whole burning issues, and some say, well, why the strike now? And isn't it unethical for doctors to go on strike and seem to prioritize pay over lives?
I can always say the people who are taking the lives of Nigerians for granted as the government. We are employees of the government, and we do our work. We expect basic remunerations, pay us for what we do. But when the government fails to do their basic minimum, that is what results in strike. Now, it's important to know that before the strike action started, we had multiple negotiations, meetings, different memorandum of understanding, action, call it whatever you call it, over the last 3-4 years, and they were not honored by the government. So if it's pain in our hearts, we feel that the only way government may listen to us is by going on strike.
Okay, but you've been mentioned of you had memorandum of understanding and various meetings, but don't you think going on strike now is rather too colossal, because looking at the challenge of lives lost? Why don't you take up the option of maybe running skeletal services?
Well, we've tried a lot of things, and when the government is insincere and don't keep their own promises, it has been shown that only the strike action has actually made government sit on their toes. You sign an understanding, and months after or years after, you've not implemented it. You try skeletal services, it doesn't really affect them. They don't attend clinics in Nigeria. So the only way we can get attention is by, okay, since you're not paying us, we are not earning anything for the work we are doing. I mean, it's best to stay at home and not be paid than to keep working and suffering and dying, because many of our members have died and not been paid in the process. So this is our last option. It's a sad option. Most of us love to work. We are workaholics, if you call it.
Okay, do you call it a sad option? But some believe that it started on the wrong footing, because even the reports have it that the NMA dissociated it from this current strike. What do you have to say on that, Dr. Elama?
I would say those reports are not true. Some days ago, our Edo State NMA chairman was here, along with our president, and he discussed and said categorically, I watched it live, said categorically that the NMA is backing the AROD on this particular strike. The NMA is actually a parent body for the AROD, so whatever the AROD does, the NMA follows. And I want to say this at this point, that this strike actually is for the common man, the common Nigerians that don't have money to go abroad for treatments. This strike is to make sure that they get effective care, they get the best from healthcare in Nigeria. How does this go? When you take care of the person taking care of the Nigerians will be okay. Take care of the doctors. Okay, now we have school fees to pay next month. You know what that means. Somebody has not been paid for 6 months, and that person is going to attend to you. Will you want somebody that is thinking of how to raise fees for the children, take care of you? He will not be listening to your complaints. What we are saying is pay the wages of those that have worked. Pay them. That's all. Basic demands.
Okay, but what do you think of this? Because some say that there are some professions that shouldn't even go on strike, looking at the sensitive nature of the job they do. Don't you think the medical practice should be part of that?
Yes, the medical practice is essential. However, the practitioners are more essential. Meaning, if you want essential services to continue, you have to ensure that the essential workers are well taken care of. Now, a lot of confusion about the strike borders about salaries and payments. No, that's not all we're fighting for. We're fighting for to stop the indiscipline in the health sector, where a leader can wake up one day and pass a memo changing everything. For example, the copper doctors in Nigeria and interns are no longer entitled to allowances because of a new policy brought up by the head of service. So those are the kind of things we want to stop. Also, we want a place where when you go to the hospital, you should be able to get your face mask, you should be able to get water to wash your hands, you should be able to get adequate materials. I read something yesterday about a medical student who died because she couldn't get, she was in a hospital in the north that could not diagnose leukemia. They did not have the necessary equipment to diagnose it. Now, this happens because our leaders do not go to our hospitals. If the governor of that state had to go to that hospital, I'm sure those things will be available. So we're not just fighting for salaries. Yes, it's important because, I mean, you can't use those equipment if you're hungry. I'm sure you agree with me. However, even the equipment we don't have, as simple as running water, is not present in many centers. It's sad. You go, you see a patient, either you operate, there's blood or secretions in your hands, and you cannot get water to wash your hands, meaning you're going to transmit infection from one patient to another. So this our strike is not just about salaries, it's about our treatments, about the healthcare facility as a whole. Okay. And we're not just fighting for doctors, we're fighting for every health worker in the country.
Okay, NARD has been dragged to the industrial court and was supposed to have a proceedings yesterday, but it was adjourned to September 15 as reports would have it. How do you agree that?
Well, I think it's a funny route to take by the government. If a pressure group or a group comes and asks for their remuneration, I don't think the best way to go is to take them to court. However, that's where we find ourselves, but
that's where the issues are treated in the industrial court.
Yeah, not necessarily. I think that's why I said the issue is basic. Okay. Pay these people their salary. They have worked. Pay them. And if you pay them, you don't have to go to court. However, we were in court yesterday. The Ministry of Health officials were there, and they didn't want us to even speak. And there was no right for fair hearing. And the judge said, well, since it's like this, we adjourn the case till September. So that's where we are now.
Well, there's this no work, no pay rule that the federal government is bringing up. What do you think about that? And how do you think that can be handled in terms of if it happens?
As illegal as it is, we're prepared for anything. I always joke about that. People worked, they didn't get paid. So now let's not work. If we're not going to be paid, it's okay. But however, it shows the states we are in this country, the level of rot we've gotten to. What we were taking to court yesterday was to implement this no work, no pay. Like Dr. Elama said, if you had paid these people in the first place, you wouldn't have to implement no work, no pay. But however, the judge, in his wisdom, called them out and told them, you want me to send them back to work? Because that was a request, let them go back to work while we're negotiating. And I said, no, we have to hear them. So he has adjourned the case till September 15, meaning legally the no work, no pay issue is not supposed to hold. I won't be surprised if it stands, and we're prepared for it.
Even if it comes up.
Like I said, people have not been paid for 21 months. And 1 extra month, I'm not sure we will die. But it just reaffirms our belief that we need to fight these rots so that we can save the healthcare system and the healthcare sector from this level of abuse that we are facing.
In case you're just joining me as TMI, and we've been having a chat with Dr. Ofani Ifeanyi. He is the President UBTH chapter, and of course with Dr. Elama Ikpemi Nogena, and the Secretary of the body, UBTH chapter. And we're looking at the strike action, and looking at this from now till it's going to be September 15. It's a long stretch. What do you guys see as a remedy to close the gap in terms of possible loss of lives at present? Dr. Elama, because we can't take that away, the fact that lives are being lost. And isn't that worrisome to the body?
Yes, we are not happy with the state at which things are now, and that is why we have always craved for speedy resolution of issues, and that's why we have always persisted in working and all. However, it's the lives of the citizens of any country is with the government. The governments are responsible for the lives of citizens. Now the government should push for speedy resolution of these issues. That is what we're asking. I want Nigerians to join their voices with us to tell the government to sort out these issues. These issues are very easy to solve. Pay these people's salaries and they go back to work. Sort out the health system, the memos that bring confusion and problems, withdraw them. These things are very easy things to do. It's just the will and sincerity that we crave for.
So the only way out is for the government to look into these demands. Otherwise, you are not quitting from the strike. You're not calling off the strike.
Well, you don't call off a strike when you're already wounded. You want to recover. Right now, we are the wounded, we are the injured, and we want the government to help to heal us so we can heal others.
Okay, but this impression made by the federal government also that the state government is to attend to some of your grievances.
Yes,
what do you make of that?
We have about 22 demands, which have spanned over up to 10 years, since 2014, about 8 years now. Now, of those demands, 8 are for the states. The others belong to the federal government. Like I said, most of these memos do not come from the state government. They are federal government issues. So it boils back to the insincerity of the government. They come and lie that it's the states that have issues. However, it's the head of service is not a state worker. It's a federal government worker. The Minister of Health is not a state worker. These memos come from Ministry of Health. I don't think that's state. So we want sincerity on the part of the government. They need to be honest, own their problems, and then maybe when they own it, they'll be able to solve this problem. But denial doesn't really help anybody. I mean, it's unfair when you tell me that it's only states that are owing people, for example. Let's use that as an example. Meanwhile, UCH is not a state hospital. That's Ibadan. It's not a state hospital. University of Port Harcourt Teaching Hospital, it's not a state hospital. Over 200 people are being owed in UCH. So it just shows that the government is insincere. For the corporate doctors, I don't think they're not under the state. I'm sure you know that. For house officers, taking house officers under MDCN rule, which is problems, it's not under state, because state hospitals are not even captured under the MDCN platform for now. So it just boils down on insincerity of the government, and that's where we have the problem. Be sincere, own your faults, and they will move forward. When we've had faults in the past, I remember 2017, there was a court case that we didn't follow due process. We accepted it. It was our fault, and we called off our strike. But when we followed due process, we gave you 100 days notice, went on strike for 10 days, called it off in good faith. Rather suspended it in good faith, and resumed the strike. I mean, after 130 days, it shows that you are not sincere, and then your solution is to go to courts rather than solving the problems.
Okay, which means even the NMA was aware of the strike you were to embark on before the strike.
Everybody was aware. Everybody. Federal government was aware. All the states were aware because we have been communicating with them. The negotiations that we've had, the NMA National Secretary is always there. But we've realized that we keep talking and nothing is going on. It keeps signing papers and memos and all. Nothing is going on. So, and we realize that all what we've gotten in this health sector, sadly, have come from strikes. If you talk about the COVID-19 allowance, where countries around the world were willingly giving their doctors, we have to go on strike to get that.
Okay, but again, some will also feel that instead of going on this strike in total, you people should have done the one in strike like 1 week or two. Did you do that? Elama.
As you said previously, we have had a series of
meetings,
strikes, previous strikes, short duration, Nigerians intervene, and we call it off. That's where we signed the latest one, which is the Memorandum of Action. Now, for you to sign a Memorandum of Action means the government acknowledged that there were problems. The association acknowledged that there were problems, and both came together to sign a document. meaning both parties have agreed that there are problems. Now we waited for 130 days for this problem, and in that signing, they had timelines. That within 2 weeks, this will be done. Within 3 weeks, this will be done. Within a month, this will be done. And we waited in good faith because of the love for our patients, because of the love for the job we do. We waited. And after 130 days, when we ask again, we hear stories. That's why we talk about insincerity. You can actually tell us that I will do these 5 things first. We don't have money for these ones. We'll be able to do this. And if you can do those ones you say you'll be able to do, then we hope for the rest.
Okay.
But you have done none.
Okay, thank you very much, Dr. Elama, for taking our time, and big thanks to you, Dr. Ifeanyi, for taking our time to be part of this show. Well, we just hope that the government will look at what the responsibility falls, both parties though, but the government is really, we're hoping that issues of this nature will be resolved very quickly, and proactiveness is quite key in terms of resolving this, most especially as it borders on the health sector. Well, this is what we call it a wrap on this segment. We're going to be also looking at issues about the Afghanistan situation, the saga, the government being taken over by Taliban forces, and the evacuation of foreign nationals, which is trendy right now. Stay with me.